Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, my classmate, my director. First of all, on this wonderful occasion, it's a great pleasure for me to stand before you all to deliver my speech with the title COVID-19. I want to tell 1. About COVID-19, 2. Stats about COVID-19, 3. Prevention measure. 4. Conclusion. We cannot say this loudly enough or bizarrely enough or often enough. All countries can still change the course of this pandemic. COVID-19 is an infectious disease caused by the recently found virus known as SARS-CoV-2 or coronavirus. Before the outbreak originated in Wuhan, China on December 2019, there was no information about this virus. History: the oldest common ancestor of coronavirus has been dated as far back as the 9th century BC. Some studies published in 1990 specified the most recent common ancestor as follows. 1. About coronavirus. Symptoms of COVID-19: high fever. The body temperature can exceed 37 Celsius degrees or 99 Fahrenheit degrees. Tiredness. The body feels completely tired and without energy to perform normal tasks. Dry throat, irritation, and constant choking without expelling any mucus. People. This disease can spread from person to person through small droplets from the nose or the mouth when the infected person coughs or exhales. Surfaces: the small droplet land on surfaces, which means any person that touches the surfaces and then their eyes, nose or mouth can become infected. Asymptomatic people: many people infected with COVID-19 show mild symptoms, especially during the first stage of the disease. Thus, you can still catch the disease from an infected person who only has a mild cough and doesn't feel ill. Infographic: tiredness: the body feels completely dry, without energy, dry cough, constant coughing without expelling any mucus, high fever, the body temperature can exceed 97 Celsius degrees, difficulty breathing, breathing actually feels more difficult. Okay, what do what to do if you have symptoms? Step 1. You have symptoms or have been in an infected area. Step 2. Call the designated phone number for your region. Step 3. You will be given a home desk over the phone. Step 4. Patiently wait for the result of the test. Step 5. Follow the instructions provided by the doctor. About 90%, about 80% of people recover from this disease without needing special treatment. 2. Stats about coronavirus. 3. Prevention measures. 4. Antibiotics do not work against coronavirus. Protecting yourself and preventing the spread of the disease. 1. Wash your hands with an alcohol-based sanitizer or with soap and water. Keep a distance of at least 1 meter between yourself and anyone who coughs or sneezes. Try your best not to touch your yes. Try your best not to touch your eyes, your nose, and your mouth. Cover your mouth and your nose with a bin, a pillow, or a tissue when crouching. Seek medical attention if you have difficult breathing and a high fever. Follow the follow the direction of your national or local health authorities. Protection measure for people that are in or visited infected area. 1. Stay home if you do not feel well. Even if you feel mild symptoms such as headache, slight fever, and runny nose. 2. If you need to go out, for example to buy food and supplies, wear a mask to minimize the risk of infecting others. 3. If you have difficult breathing and or a high fever, seek medical advice as soon as possible. 4. Call your provider and inform them of any recent travel, especially to countries with report cases. How to use mask. Before wearing a mask, wash your hand with alcohol base, disinfectant, or with soap and water. Cover your mouth and nose with the mask and make sure the mask is firmly pressed against your face. Do not touch the mask while you are wearing it. If you do, wash your hand with an alcohol-based disinfectant or with soap and water afterward. Replace the mask as soon as it gets wet and do not resize disposable masks. Remove them mask from behind. Do not touch its front side. Throw it away in a closed container and then wash your hands with alcohol-based disinfectant or with soap and water. I think that's all. Then I'm sorry for all mistakes in my presentation. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.